Let's talk about kidneys. Let's discuss type of receptors in the kidneys and effects which occurs after stimulation of these receptors. In general, maybe you know, maybe you don't know, maybe you will know right now. Kidneys have one type of receptors. This is beta-1 adrenergic receptors. Beta-1 adrenergic receptors. This should look like a kidney. Looks like a kidney, behaves like a kidney. So most likely it is a kidney. In the kidneys, we have beta-1 adrenergic receptors. Where these beta-1 adrenergic receptors are located? They located in juxtaglomerular cells. In response to stimulation or after stimulation of these beta-1 adrenergic receptors, I'm drawing plus here, beta-1 adrenergic receptors, or in response to activation of sympathetic nervous system. And where does sympathetic nervous system live? It lives in adrenal medulla, right? So we have epinephrine, norepinephrine, or by activation of kidney sympathetic nerves or kidney sympathetic fibers, juxtaglomerular cells release what they release. They release renin. And renin is a major enzyme in renin-angiotensin-aldosterone system. We know, right? So renin converts angiotensinogen to angiotensin 1. After that, we have ACE enzyme that converts angiotensin 1 to angiotensin 2, and angiotensin 2 interacts with angiotensin receptors, type 1 receptors for angiotensin 2, and these receptors located in many places, and one of them, it is adrenal cortex and vessels. So in response to renin releasing, we have activation of renin-angiotensin-aldosterone system, and as a result we have rising in blood pressure, we have vasoconstriction, and we have fluid retention, and this causes expanding in blood volume. So please remember beta-1 adrenergic receptors in the kidneys, and we also should assume, we should know, right, that beta blockers they block this beta-1 adrenergic receptors, and doesn't matter are they selective or not selective, they block these beta-1 adrenergic receptors. So in the kidneys, beta-1 adrenergic receptors, but not everything is so easy with the kidneys, as we said only one part of this chain. We said receptors on juxtaglomerular cells. But now let's say a few words about glomerulus, and let's say a few words about vessels and glomerulus. So we know that we have kind of glomerulus, and we have two vessels, right, in glomerulus. Here we have Bowman's capsule. So we have two vessels. The first one is a Vas Afferent, and second one is a Vas Efferent. And you see that diameter of these vessels are different, right? Because diameter Vas Afferent greater, and the diameter of Vas Efferent is smaller. And very important to understand type of receptors that are really present in the Vas Afferent and Vas Efferent, because many questions, many concepts are focused on that. So Vas Afferent and Vas Efferent both have alpha-1 adrenergic receptors. More for Vas Afferent, so let's make it bigger. Alpha-1 adrenergic receptors. bigger, and Vas Afferent has smaller amount of alpha-1 adrenergic receptors, and we know that alpha-1 adrenergic receptors, they copulate with GQ proteins, and they respond. They have like a second messengers, inositol triphosphate and diacylglycerol, and result of activation of alpha-1 adrenergic receptors, the calcium releasing and vasoconstriction. So in case of activation of sympathetic nervous system, we have vasoconstriction of Vas Afferent and Vas Afferent, and as a result, renal blood flow decreases. Renal plasma flow decreases. But what we should keep in mind? We should keep in mind that Vas Afferent has D1 receptors. What does it mean, D1 receptors? The dopaminergic receptors type 1. In general, we have 5 subtypes of dopaminergic receptors, and many of them are located in the central nervous system, but at the periphery, we have D1 receptors for dopamine, dopaminergic receptors. And activation of these receptors causes relaxation of Vas Afferent. Relaxation. D1 adrenergic receptors copulate with GS proteins. Activation of them stimulates adenylate cyclase and converts ATP to cyclic adenosine monophosphate, and this causes relaxation in smooth muscles. Two important medications we should keep in mind: dopamine, of course, and another one, phenaldopam. So phenaldopam and dopamine, they stimulate dopaminergic receptors, and as a result, we have dilation of afferent arterioles, and they used in order to improve patient condition in case of shock, shock of different etiology, cardiogenic shock or another one. So activation of D1 receptors causes vasodilation. So stimulation causes vasodilation. Third type of receptors that present in Vas Afferent, the prostaglandin receptors. And prostaglandins are maintaining Vas Afferent diameter. So they increase Vas Afferent diameter, and they have vasorelaxant properties. So they increase diameter of Vas Afferent and also related to vasodilation. So prostaglandins, they increase renal plasma flow, because they dilate Vas Afferent, they increase renal plasma flow, and as a result, they increase GFR, glomerular filtration rate, with no significant changes in filtration fraction, because both of renal plasma flow and GFR are rising. What is important? Important that patient who taken non-steroidal anti-inflammatory drugs, NSAIDs, like aspirin, like ibuprofen, and other one, may have hypertension. What is the genesis of this hypertension? We know that non-steroidal anti-inflammatory drugs, they block prostaglandin synthesis, because we have two pathways. We have one pathway is COX-1 and COX-2 pathway related to production of prostaglandins and thromboxanes, and another pathway is 5-lipoxygenase pathway for leukotriene production. So administration of non-steroidal anti-inflammatory drugs decreases prostaglandin production, and as a result, less amount of prostaglandins present, and this causes constriction of Vas afferent. In response to constriction of Vas afferent, we have decreasing in renal blood flow and renal plasma flow, and really juxtaglomerular cells, they response to that and increase renin secretion. As a result, we have a rising in blood pressure. Yeah, so administration of non-steroidal anti-inflammatory drugs in some individuals may cause rising in blood pressure. So we done with Vas afferent.